Welcome everybody from Cortina, Italy. I would like to thank Professor Carsten Schmidt-Weber from the Center of Allergy and Environment in Munich very much for accepting our invitation for an interview about this recently published review in the journal Allergy. And we're here at the EACI Winter School, and let's start with the first question. What was your motivation to write such an extensive review on current and future biomarkers in allergic asthma?
Well, we currently have only few predictive biomarkers, but a lot of things we can measure, and this review is listing many biomarkers both in blood, in serum, in nasal secretions, but also on the surface of cells. And I think it's very important to group them and to find combinations which then in the future can give a prediction on certain phenotypes of disease, of progression of the disease, or also on therapeutic benefit in the patients.
Could you think of a biomarker which you consider as the most promising one, which is currently applied, or a group of some biomarkers?
Though, I mean, generally speaking, there's no predictive biomarker for anything, really. I think the only area where we have, I think, a good success now is in asthma with the eosinophilic and neutrophilic asthma. This is already entering, so to say, also clinical practice. So, for example, the use of dupilumab, this anti-IL-4 treatment, was performed selectively in eosinophilic asthma, so searching for a Th2 type of asthma. And I think this is the way to go, and this is, I think, very promising also in the future. And I think there we have now to gather more specific markers that are predicting this kind of subtypes.
Where do you see the greatest innovation potential in the allergy biomarker field?
I think the greatest innovation is now that we can combine several biomarkers with novel techniques, and I think also the opportunity to use non-invasive marker even for local inflammation such as nasal secretions, sputum, etc. I think that's very promising, and I think will be very specific. I think also in the field of innovation is that and I think this is one of the issues of this review, is that we are looking at epithelials or tissue localized biomarkers, and I think this will be very helpful to understand the microenvironment and the specific pathology in disease.
What do you think, which novel technique could be particularly helpful for biomarker analysis and the diagnosis of asthma?
I think the key problem which we currently have is the sensitivity. So I think for example, those markers from the type 2 immunity, like IL-4, it's very hard to detect, and I think the more specific and the more sensitive we get, the more promising. I think a second field of innovation is in flow cytometry. Also here we can combine multiple surface markers, and you can see already in several studies that if you combine multiple markers, you can get more and more specific, and that I think helps to generate prediction.
Okay, then my last question would be, what do you think will be the biggest challenge in the asthma biomarker discovery in the future?
I think the challenge now is that we all work together. I think this is one of EACI's strengths which we have to use now, because we have to validate the markers and really crank out the predictive value of a certain set of biomarkers, and I think this is something which you can only do together, and I think we need large cohorts and very good and specific diagnosis to really make the point here.
Definitely. Yeah, thank you very much for the interview, and
Thanks,
have
Anke.
some more good times at the EACI Winter School.